5. Common medication mistakes seniors over 65 often make, and how to avoid them. Have you ever taken your medication and still felt no better? Or worse, you felt more tired, dizzy, confused, had stomach pain, or your heart started racing for no reason? Here's the scary truth. Many older adults are taking the right prescriptions, but using them the wrong way, and that can lead to serious side effects, dangerous drug interactions, increased risk of falls, strokes, or even death. A study in the US found that 1 in 3 people over 65 takes their medications incorrectly every single day, without even knowing it. In today's video, we'll uncover 5 common medication mistakes seniors often make, and more importantly, simple, effective ways to avoid them based on advice from top US medical experts. Don't worry, you won't need a medical degree to understand this. We'll break it down in a calm, easy-to-follow way. Perfect for anyone over 60. If you take daily medications or have aging parents or loved ones, this video could help prevent some surprisingly dangerous mistakes. And if you're new here, make sure to hit subscribe. On this channel, we share practical, inspiring health tips made just for older adults who want to live healthy, stay independent, and feel truly alive after 60. Thank you for being here with us. Mistake number 1. Taking medication on an empty stomach, a hidden harm. Once you're past 65, taking medication daily becomes a routine part of life. But there's one habit that seems harmless, yet silently damages your stomach little by little every single day. That habit is taking your medication on an empty stomach. Why do so many people do this? It helps the medicine absorb faster. My doctor said to take it in the morning, so I take it right after waking up. I skipped breakfast but still took it to stay on schedule. Sounds reasonable, doesn't it? But here's the truth. Not all medications should be taken on an empty stomach, and some can be downright dangerous if taken at the wrong time. What happens in your body when you take meds without food? Our digestive system follows a biological rhythm. When you're hungry, your stomach produces more acid in anticipation of food. If you take medicine at this time, especially acidic or irritating medications, they come into direct contact with the delicate stomach lining, causing chemical burns to the lining, leading to ulcers, stomach pain, nausea, or a burning sensation. Over time, even bleeding ulcers or stomach perforation. Medications you should never take on an empty stomach. Sham 1. NSAIDs, non-steroidal anti-inflammatory drugs. Ibuprofen, naproxen, diclofenac can easily cause ulcers when taken without food. 2. Antibiotics like tetracycline, doxycycline strongly irritate the esophagus and stomach lining. 3. Iron or zinc supplements often cause nausea, indigestion, or diarrhea if taken without food. 4. Oral diabetes medications can cause sudden drops in blood sugar, leading to fainting or worse. A real-life story. Mrs. May, 68, from California, was prescribed diclofenac for knee arthritis. She took it at 6 a.m. every morning before eating, thinking, earlier means faster relief. 2 weeks later, she was rushed to the hospital with severe upper abdominal pain. Diagnosis: acute gastric ulcer. When asked about her medication routine, she was stunned. "I thought taking it early would be better." So when should you take your meds? It depends on the medication. Medications that require an empty stomach, like levothyroxine, thyroid hormone, or osteoporosis drugs. Your doctor will clearly state this on the prescription. Medications that should be taken after food, including most blood pressure pills, cholesterol meds, anti-inflammatories, and vitamins. Best taken 15 to 30 minutes after a meal when food has cushioned your stomach and aids absorption. Some need to be taken with meals, especially fat-soluble vitamins A, D, E, K. Simple reminders. Not sure? Ask your pharmacist. It only takes 2 minutes, but could protect your gut. Don't assume or rely on habit. Each medication is different. If your medicine causes nausea or stomach pain, it might be a sign you're taking it at the wrong time. Bottom line, taking medication on an empty stomach doesn't make it work faster. It can actually cause harm, reduce effectiveness, and lead to needing more medication later on. Protect your stomach. Time it right. Stay informed. Mistake number 2. Stopping medication. When you feel better, a risky decision. Have you ever thought, "I feel better now, probably healed. I don't need the meds anymore." Or maybe, "These pills make me tired. I'll just skip a few days." If you've had these thoughts, you're not alone. Many people over 65 tend to stop taking their medications once their symptoms improve. But here's the hard truth. This is one of the most dangerous mistakes seniors make, because the consequences often don't show up right away. They silently chip away at your health day by day. Why do seniors often stop their meds too soon? 1. They feel better. Assume they're cured. 2. Worried about side effects. 3. Tired of taking multiple pills every day. 4. Want to go natural and avoid being dependent on meds. 5. Trying to save pills or money, afraid they'll run out. These reasons are completely understandable. They're real human concerns. But sadly, most are based on feelings, not medical understanding. What happens when you stop your meds without guidance? If you're on treatment for chronic conditions like high blood pressure, diabetes, high cholesterol, heart issues, or osteoporosis, the medication isn't meant to cure you right away. It's designed to control your condition, stabilize it, and prevent it from getting worse. So remember, if you're feeling better, it's not because you're cured, it's because the medication is working. If you stop suddenly, your body can spiral out of control. Blood pressure can spike. Blood sugar can become erratic. Cholesterol can surge. Heart rhythms may become unstable, all of which raise your risk of stroke, heart attack, or worse. A real-life example. Mr. Lamb, 72, had moderate high blood pressure. After 3 months of consistent medication, his readings normalized. He assumed he was cured and stopped taking his pills to feel lighter. One morning while watering his plants, he collapsed. At the hospital, his blood pressure was 190/110. Stroke risk was off the charts. Doctors said, if he hadn't been brought in immediately, he may not have survived, and never known why. Medications you should never stop on your own. 1. Blood pressure meds. Sudden stop equals rebound, hypertension, stroke risk. 2. Diabetes medication. Skipping doses equals silent high blood sugar, kidney, eye, and nerve damage. 3. Blood thinners, aspirin, clopidogrel, etc. Stop abruptly equals blood clots return, heart attack, stroke. 4. Heart failure or arrhythmia. Meds. Discontinuing equals heart loses rhythm control, high risk of cardiac arrest. Want to lower your dose or stop a med? There's only one safe way. Talk to your doctor. Your doctor may recheck your condition with tests. Gradually reduce your dose if safe. Switch to a milder alternative. Closely monitor you during changes, but never just stop for a few days to see what happens. For a young person, that might only cause dizziness, but for someone over 65, it could be the thin line between stability and crisis. Important reminder: feeling better doesn't mean the illness is gone. It could simply mean the medication is helping you feel well. Bottom line: stopping your meds on your own can undo months of healing. If you're unsure, ask your doctor. You have every right to understand what you're putting into your body and how it's helping you. Mistake number 3: mixing prescription drugs with herbal remedies. Natural doesn't always mean safe. After age 65, many people turn to herbal remedies, traditional medicine, or natural supplements in addition to their prescribed medications. For example, taking blood pressure pills plus garlic tea, taking diabetes meds plus cinnamon powder or fenugreek seeds, using cholesterol medication plus turmeric capsules or reishi mushroom, supporting liver health with herbal teas like chanca piedra or roasted black bean water. It all sounds reasonable. After all, everyone wants faster results, and herbal products are often seen as gentle and side effect free. But here's the truth. Combining the wrong herbs with the wrong medications can lead to dangerous interactions, reduce the effectiveness of your medicine, or cause serious damage to your liver, kidneys, or heart. Why natural doesn't always mean safe. Herbs contain bioactive compounds, meaning they act on your body just like drugs do. The problems are: doses are often unclear, quality is not standardized, effects vary from person to person, and most importantly, they haven't been fully studied for interactions with prescription meds. When mixed with medication, herbs may increase or decrease drug potency, leading to meds not working as intended, unexpected side effects, liver and kidneys overwhelmed, trying to process foreign substances. Examples of dangerous interactions between herbs and medications. 1. Turmeric, curcumin, can slow down liver metabolism of drugs. Risk of drug accumulation in the blood, potential overdose, liver damage. 2. Garlic, ginger, ginseng, ginkgo, biloba, have blood-thinning properties. When taken with aspirin or anticoagulants, warfarin, clopidogrel. High risk of stomach bleeding or brain hemorrhage. 3. Licorice root, can raise blood pressure and cause fluid retention. Combined with diuretics or heart medications, extra strain on the heart. 4. Chunka Piedra, black bean tea, marketed as liver-friendly, but high doses over time can damage liver cells instead. Real story. Mr. Hoa, 69 years old. Mr. Hoa had stage 2 fatty liver and took prescription meds daily. At the same time, he started drinking roasted black bean tea and consuming turmeric powder, based on his friend's advice. After 2 months, he became fatigued and noticed yellowing of his skin. Tests showed his liver enzymes had quadrupled. The doctor concluded the combination of prescribed medication and unsuitable herbs overwhelmed his liver. So, what should seniors do? 1. Never combine herbs or supplements with prescription meds without medical advice. Always consult your doctor or pharmacist, even for natural products. 2. Avoid buying unverified herbal products online or from unknown sources. No certification, no safety standards equals serious health risks. 3. If you want to try herbs, use only certified products with clear dosage instructions. Never take them at the same time as your prescription meds. 4. Always inform your doctor about any supplements or herbal teas you're taking. This allows them to check for interactions and adjust your treatment safely. Important reminder: natural doesn't mean side effect free. Herbs are only beneficial when taken at the right dose, for the right condition, at the right time. If you found this information helpful, be sure to hit the subscribe button so you won't miss other valuable health videos from US-based experts dedicated to seniors. And don't forget to share this video with a friend or loved one who might be mixing herbs and medications. Let's all learn to take our meds wisely and live healthier together. Mistake number 4. Taking medication with juice or milk. A healthy habit that can backfire. Many seniors have the habit of taking their medication with fruit juice, milk, or even coffee with milk, thinking, orange juice makes it easier to swallow and adds vitamins. Milk protects the stomach from harsh medicines. Juice is natural. What could go wrong? But in reality, this common habit can interfere with how medications work, or worse, cause unexpected side effects that may harm your body. Why juice and milk can disrupt medication effectiveness. 1. Fruit juice, especially grapefruit juice, contains compounds called furanocoumarins. These block the liver enzyme CYP3A4, which helps break down many medications. Result: the medication stays in your system too long. Higher risk of side effects or toxicity. 2. Milk and dairy products, yogurt, cheese, etc. High in calcium, protein, and fat. These nutrients can bind to certain medications and prevent proper absorption into the bloodstream. Specific examples of dangerous interactions: antibiotics in the tetracycline and quinolone families, like ciprofloxacin. Taken with milk, up to 50% less absorption. Poor infection control, risk of antibiotic resistance. Osteoporosis medications, like alendronate. Taken with milk, completely ineffective. Heart, blood pressure, and cholesterol meds, like amlodipine, simvastatin. Taken with grapefruit juice. Drug buildup, causing dizziness, dangerously low blood pressure, or irregular heartbeat. Painkillers, NSAIDs, like ibuprofen or naproxen. Taken with fruit juice. Stomach irritation, increased risk of ulcers. Real story. Mrs. Nguyen, 67 years old. Mrs. Nguyen was prescribed medication for a urinary tract infection. She took her pills every morning with a glass of fresh milk to soothe her stomach. After 5 days, her symptoms hadn't improved. Tests revealed her drug levels were lower than expected. The doctor explained milk blocked the drug absorption and advised her to take the pills with plain water instead. So what's the right way to take medication? 1. Always use plain water, preferably filtered or boiled and cooled. Ideal amount: 150 200 ml. Sip slowly, don't gulp. 2. Avoid using the following to take medication: milk, coffee, tea, soft drinks, fruit juice, alcohol. These drinks can alter absorption or interact with your medicine. 3. If you want to drink milk or juice, make sure to separate it from your medication by at least 1 to 2 hours. This helps prevent absorption issues. Remember, medication is meant to heal, but taking it with the wrong beverage can make the treatment less effective or even harmful. Clean, plain water may seem simple, but it's the safest and most powerful partner to your medicine. A small change in your routine can lead to a huge improvement in health outcomes. Mistake number 5. Not telling your doctor about all the medications you're taking. One of the most common and most overlooked mistakes among seniors is this: not disclosing all medications, vitamins, supplements, or herbal remedies to your doctor. Why is this dangerous? Most seniors take multiple medications at once, often prescribed by more than one provider, such as prescriptions from your primary care doctor, joint supplements from a specialist, over-the-counter vitamins from the pharmacy, herbal teas or remedies recommended by friends, even leftover pills from a previous illness. Sound familiar? Many people don't bring a full list of current medications to their appointments, assuming, "I've taken this for years, it's not new, so I don't need to mention it." But leaving out this information could lead your doctor to prescribe something that conflicts with what you're already taking, resulting in serious side effects or reduced treatment effectiveness. What can happen if you don't share this info? Uncontrolled drug interactions can cause excessive drowsiness, dizziness, stomach upset, rapid heartbeat, or arrhythmia. Duplicate ingredients. You might take 2 different medications that both contain paracetamol, acetaminophen, ibuprofen, or the same antibiotic. Risk of overdose or liver damage. Reduced treatment effectiveness. Example: taking calcium supplements without telling your doctor, who then prescribes thyroid medication. The calcium can block the absorption of the thyroid drug if taken together. Real story: Mr. Stephen, age 74. Mr. Stephen was on regular blood pressure medication. He recently visited a doctor for knee pain and was prescribed anti-inflammatory painkillers. He forgot to mention that he was also taking low-dose aspirin, 81 milligrams, daily, for heart health. A week later, he had a gastrointestinal bleed and was rushed to the ER. Why? The combination of aspirin and the painkiller increased his risk of internal bleeding. How to avoid this mistake? Keep a complete, up-to-date list of your medications. Include names, doses, and timing. Don't forget vitamins, herbal teas, supplements, over-the-counter meds. Bring that list with you to every appointment. You can write it on paper or store it in your phone for easy access. Ask your doctor or pharmacist questions. Will this new medication interact with what I'm already taking? When should I take this so it doesn't interfere with my other meds? Never stop or switch medications on your own. If you want to stop taking something, consult your doctor first. Sudden withdrawal can be harmful or even life-threatening. Remember, as we age, our bodies become more sensitive to medications. And your doctor can only treat you properly if they know exactly what you're taking. Taking care of your health after 65 is a team effort between you, your doctor, and your loved ones. Being honest and proactive about all your medications is the first and most important step towards safe, effective treatment. Growing older is not the end. It's a turning point, a time to slow down, listen to your body, and care for yourself in a smarter, more intentional way. Today, we've walked through 5 common medication mistakes that many seniors over 65 make. Each of these errors can quietly turn a helpful pill into a dangerous trap, unless we recognize them and take action. Let's recap. 1. Taking medicine on an empty stomach can cause ulcers or damage your liver. 2. Stopping medication when you feel better may lead to relapse or resistance. 3. Missing doses or taking the wrong amount reduces treatment effectiveness. 4. Drinking juice, milk, or coffee with medication causes dangerous interactions. 5. Not telling your doctor about all your medications risks overdose or drug conflicts. Growing older is the perfect time to become your own best friend. Each pill you take is more than just a prescription. It's a choice to live informed, to live responsibly, and to live well for many more years to come. Whether you live alone or with loved ones, whether you're healthy or managing chronic conditions, knowledge is the key to navigating your senior years with confidence and strength. Quick reminders. Ask your doctor whenever you're unsure. Write down all your medications and bring the list to every appointment. Never take pills with juice, milk, tea, or coffee, only water. Set a reminder alarm if you tend to forget your doses. And please, never stop taking your meds just because you feel fine. Healthy aging isn't luck, it's a daily decision. If you found this video helpful, please share it with friends, family, or in senior groups you know. Many older adults are making these mistakes without even realizing it. And your small act of sharing might help someone avoid serious harm. And if you haven't subscribed yet, now's the time. Every week, we bring you clear, compassionate health advice and inspiration made especially for older adults in the US and around the world. We can't stop time, but we can choose to live healthier, happier, and with greater purpose every single day. Thank you for watching. Stay well, stay wise, and may your golden years be filled with strength, joy, and clarity. We'll see you in the next video.